45 medicinal plants that have contraindication and side effects. Education about science and medicine, prepared by editors of a channel All Scientifical. What is therapy? Therapy is the treatment of disease, which includes taking various medication as well as medicinal plants. What is phytotherapy, herbal medicine? When therapy is based on taking remedy based on medicinal plants, it is called herb medicine or phytotherapy. Contraindications for herbal medicine, phytotherapy. The most common contraindications are pregnancy, hypertension, and diabetes. Althea officinalis, the marshmallow. When taking concomitantly with other medication, marshmallow may impair the absorption of other medication. Contraindication and side effects of anise. It is not recommended to take anise during pregnancy. After all, food products with a slight content of anise are allowed. Do not take anise with iron supplements. Anise may cause sensitivity to sunlight, so avoid exposure to it. Do not consume anise if you are taking hormonal medication. Arnica. It is not recommended to apply arnica to an open or bleeding skin wound. Avoid during pregnancy. May cause allergic rashes in sensitive people or with prolonged use. Astragalus. When taking a course of cyclophosphamide, it is not recommended to take astragalus. Do not use for acute infection, especially with fever and or severe inflammation. Hawthorn. Do not take hawthorn at the same time as digoxin. If you have cardiovascular disease, do not take hawthorn for more than 2 weeks. It is not recommended to take hawthorn if you have high blood pressure, which is caused by problem with the heart valves. Taking large quantity of hawthorns may cause drowsiness. It is not recommended to drive a car while using this plant. Lingonberry. Do not consume lingonberries during anticoagulant drug therapy. Elderberry. Do not take elderberry during pregnancy. Unripe fruit, leaves, bark and seed of elderberry may cause the following side effects: severe diarrhea, vomit. Fresh fruit seeds are toxic. Consume them fried or cooked. Valerian. Avoid associating valerian with the following medication: amitriptyline, Diazepam. You should not consume alcoholic beverage during treatment with valerian. May increase the effect of sleeping pills and other mood-altering medication. Stop taking valerian if you notice the following side effects: increased heart rate, insomnia, headache, nervousness. Vitex. Do not use Vitex during pregnancy. Vitex may alter the effects of birth control. Carefully read the leaflet of capsules containing Vitex if they do not also contain licorice or Siberian ginseng, which can cause increased blood pressure. Vitex may cause the following side effects: menstrual irregularities, skin rash, itching, headache, stomach disorders. Black cohosh. Avoid during pregnancy or breastfeeding. In case of treatment with estrogen, you should consult your doctor before taking black cohosh. Do not take for more than 6 months. Not recommended for use in case of disease of the cardiovascular system or in case of taking antihypertensive drug. May cause the following side effects: disturbance in liver function, circulatory disorder, vomit, nausea, visual impairment, dizziness, bradycardia, headache, disturbance in the function of the digestive system. Ginkgo biloba. Ginkgo biloba may cause the following side effects: irritability, feeling of restlessness, stomach pain, headache. It is not recommended to take Ginkgo biloba at the same time as the following medication: anticoagulants, warfarin, non-steroidal anti-inflammatory drug, aspirin, MAOI antidepressants. When taking large dose of concentrated extract more than 240 mg, it can cause the following side effects: vomit, diarrhea, rash. Elecampane. Avoid simultaneous use of elecampane with warfarin and or MAOI antidepressants. Golden seal. It is not recommended to take golden seal for more than 7 days because it reduces the absorption of vitamin B12, causing a deficiency of this vitamin in the body. Under no circumstance should you take golden seal in the following situation: pregnancy, digestive tract disorders, hypoglycemia, low blood sugar, hypertension. Also, golden seal intake should be limited in case of the following autoimmune disease: disseminated systemic lupus, multiple sclerosis, allergy to plant from the Astracea family, chamomile calendula officinalis. Never take more 2 grams per day. You should not consume a lot of golden seal due to its toxicity. Ginseng. Before taking ginseng, you should consult your doctor if you have a following condition: hypertension, headache, diarrhea, nervousness, insomnia. Some women during menopause may experience menstrual bleeding. American ginseng, like common ginseng, should not be used for the following disorders: inflammation, elevated temperature, acute illness. Avoid using Siberian ginseng if you have high blood pressure or elevated body temperature. The simultaneous use of ginseng and ephedra is not recommended. Limit your coffee intake during your ginseng treatment. St. John's wort. Do not take St. John's wort during pregnancy. It may cause skin sensitivity to sunlight, and for this reason avoid sunlight during treatment. Consult your doctor before starting treatment with St. John's wort because it interacts with certain medication and substance. Over-the-counter cold medicines, alcohol, antidepressants, tamoxifen, anti-HIV medication, digoxin, theophylline, oral contraceptives. St. John's wort can cause an increase in blood pressure if taken at the same time as a federal-based medication. Do not use St. John's wort to treat depression, a very serious illness that required medical attention. Salix. Avoid Salix if you are allergic to aspirin or if you are taking anticoagulants such as warfarin. Salix may cause the following side effects: anaphylactic reaction, pain in the kidney area, clotting disorders, liver dysfunction, bleeding in the esophagus and stomach irritation in association with alcohol, attack of bronchial asthma, allergy. Salix may interact with the following medication: sedatives, amobarbital, alprazolam, barbiturates. Ginger. If you are pregnant, you should consult your doctor before consuming ginger. It is not recommended to use ginger if you have gallstones. Saw palmetto. If you have problem with the prostate, it is recommended to consult a doctor before using saw palmetto. You should not take saw palmetto products at the same time as anticoagulants. Rarely, stomach problem may occur. Cascara. Avoid taking cascara if you are pregnant or have a debilitating illness. Do not take for more than 8 days unless this herb is prescribed by a doctor. Not recommended for use with intestinal inflammation, intestinal obstruction, or abdominal pain. May cause diarrhea and dependence on laxatives. Do not take with anticoagulants, especially warfarin. Horse chestnut. Avoid if pregnant or have kidney disease. May cause side effects when taken concomitantly with other medication, especially anticoagulants, and may cause bowel irritation. Cinnamon. Do not take in large quantity during pregnancy. Nettle. Nettle should not be used during pregnancy. The main side effects of nettle are skin reaction, minor stomach disorder, licorice. Avoid taking licorice during pregnancy. You should not take licorice if you are being treated with the following medication: antihistamines, diuretics, corticosteroids, antiarrhythmic drugs, antihypertensive drugs. In case of hypertension, you should take licorice only an extract and in not case as pure plant. Use with caution. In case of the following disorders: high blood pressure, potassium deficiency in the body, kidney disorder, disease of the cardiovascular system, disturbances in liver function, heart arrhythmia. Do not take licorice extract more than 3 times per day for no more than 4 to 6 weeks. Excessive intake can cause the following side effects: disturbance in liver function, problems of the cardiovascular system, hypertension, water retention in the body. Flax. Do not take flax seeds if you have an intestinal obstruction or thyroid disorder. Always Consume them with plenty of water. May reduce absorption of some medication. Do not heat flaxseed oil. Mint. Peppermint can relax the esophageal sphincter, increasing the risk of subdermal burns. Take mint with caution if you are susceptible to esophageal reflux. Dandelion. Do not use dandelion as a dietary supplement. Consult your doctor before using this hair to treat gallstones. Avoid taking dandelion if you have a blocked bile duct. If you have gallbladder disease, do not take dandelion root products. Fenugreek, not recommended for use during pregnancy, although quantity used in food are not characterized by side effects. Consult a doctor before use if you have diabetes or are taking anticoagulants. Papaya may cause change in glycemia. This fruit is contraindicated in diabetes mellitus. When taking warfarin, consult your doctor. Both the fruit and the enzyme it contains can interact with the medicine. Parsley. Do not consume parsley in large quantity, several bunches at a time. If you have a kidney disorder, this may cause urine volume to increase. Parsley is not used for medicinal purposes during pregnancy, can only be consumed in normal quantity in food. Psyllium. Always consume this dietary supplement with adequate amounts of water. Psyllium can cause the following side effects: constipation, flatulence. Consult your doctor before taking psyllium in the following situation: taking medication, treatment with insulin for diabetes mellitus, intestinal obstruction, Crohn's disease, ulcerative colitis, diverticulitis, problem with following. Rosemary. In large quantity, it causes heavy menstrual bleeding. Do not consume rosemary during pregnancy. Chamomile. Taking chamomile may cause an allergic reaction if you are sensitive to related plants of chamomile, for example chrysanthemum. Chamomile contains an anticoagulant. For this reason, use it with caution if you have a clotting disorder or if you are taking anticoagulants. Celery. Do not consume celery seeds during pregnancy. Use celery seeds with caution if you have kidney disease. They may have a diuretic effect, so they should not be taken if you are already taking medication with a similar effect. Avoid taking celery seeds at the same time with anticoagulants, aspirin or warfarin. Celery seeds may increase your skin sensitivity to sunlight, so avoid direct contact with it. Senna. Senna is not recommended for use during pregnancy. Treatment with this plant should not exceed 8 to 10 days. Take senna 1 hour after taking other medication and always with plenty of water. Senna should not be used in treatment of the following disorders: intestinal obstruction and other inflammatory bowel disease, hemorrhoids, diarrhea, abdominal pain. Senna should not be given to children under 12 years of age. Senna is contraindicated in case of diarrhea and watery stools. In excess, senna can reduce digoxin level, so senna should not be taken while being treated with digoxin. Only if your doctor has not prescribed this and only under medical supervision. African cherry plum. Avoid African plum during pregnancy or if you have hypertension. Consult your doctor before using African cherry to treat prostate hypertrophy. Caraway. Do not use caraway seeds for medicinal purposes for more than 6 weeks. Yarrow. Rarely, treatment with yarrow may cause a skin rash. Do not use this plant during pregnancy. In large dosage, yarrow can cause the following side effects: headache, dizziness. Yarrow increases skin sensitivity to sunlight, so exposure to sunlight is not recommended. Cat's claw. Do not use cat's claw in the following situation: hemophilia, pregnancy, drug therapy using immunosuppressants. The main side effects of cat's claw are breathing problem, pain of a level of digestive system, headache. In some cases, cat's claw can cause fertility problems. Blazing star. This plant is best known for its tonic effect on the uterus. In small quantity, blazing star is indicated for morning sickness and for the prevention of miscarriage. But during pregnancy, this remedy should only be used under medical supervision. Do not take blazing star if you are exhausted or have an acute infection. Blazing star can cause irritation of the stomach and duodenum. Common hope. Avoid consuming common hope during pregnancy or if you are susceptible to depression. Use fresh or dried hops with caution due to the potential for skin rashes. Horseradish. Avoid taking horseradish if you have the following health problem: kidney disorders, thyroid disorders, stomach ulcer. Horseradish shall not be taken by children under 4 years of age. Asiatic pennywort. You shall not take Asiatic pennywort during pregnancy or breastfeeding. Do not take Asiatic pennywort at the same time as medication for diabetes or hypertension. Consult your doctor if you want to use this medicinal plant for more time. Rarely, Asiatic pennywort may cause headache or skin rashes. Garlic. Avoid taking garlic supplements while being treated with anticoagulants, warfarin, or anti-diabetic agents. Common white harehound. Not recommended for use during pregnancy. Echinacea. Avoid using Echinacea if you have a chronic immune system disease or autoimmune disorder such as the following: tuberculosis, rheumatoid arthritis, multiple sclerosis, disseminated lupus erythematosus. Also, the use of Echinacea is contraindicated when taking the following medication: anti-tumor agents, anticholesterolemic drugs, immunosuppressive drugs, sedatives, anti-HIV therapy. Avoid taking Echinacea with medication that are toxic to the liver: ketoconazole, methotrexate, amiodarone, anabolic corticosteroids. Do not take Echinacea if you are allergic to its related plants: chrysanthemum, callistephus. The duration of a medical course using Echinacea should not exceed 8 weeks. Thank you for your attention. This material was prepared based on material from the channel All Scientifical. Attention: before using various treatment and remedies, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.